All right, Jacob, thanks. It's no secret that COVID-19 has created a host of challenges to those with the virus, as well as doctors working to fight it. Now, new research shows that stress could pose a major roadblock when it comes to recovering from the coronavirus.
Trying to parse out real information that's meaningful versus information that can actually be harmful sometimes becomes difficult.
But Dr. Amir Lotfi, the Associate Chief of Cardiology at Baystate Medical Center, tells Western Mass News that there are certain factors that will leave you at greater risk when trying to fight COVID-19.
If you're older, you have heart, lung, kidney, diabetes, high blood pressure, it has a more serious impact.
Lotfi says so far, the steroid dexamethasone and the antiviral drug remdesivir are two therapies that are working for coronavirus patients. He says while heart doctors are being supportive of the treatment, they're also concerned about a recent study following two Ohio hospitals. The study showed an increase in patients with stress-induced cardiomyopathy or broken heart syndrome, which is associated with increased stress and anxiety.
During this pandemic, obviously through social isolation, people out of work, all the other stressors that come from this, obviously they saw an uptick in the stress-induced heart attack.
According to Lotfi, social isolation adds another level of stress on top of recovering from a brand new virus.
What we're seeing is those patients who leave the hospital, they need continued surveillance.
But doctors are still working to figure that part out.
What kind of surveillance, what kind of follow-up, what to watch out for, and these are the things we'll continue to learn as we observe the situation more carefully.
Lotfi says the best method for prevention is to follow CDC guidelines, but patients should not shy away from seeking medical care.
If you have any signs or symptoms, do not delay care because of fear of going to the hospital. Because sometimes delaying care puts you at greater risk.
Dr. Lotfi says there are ways to try and reduce stress, which would lower the risk of broken heart syndrome. He recommends that family visit, even if it's virtual, as well as going for a walk in the morning or evening.